Good afternoon, everyone, and welcome to our Lunch Chats Keeping You Healthy web series. My name is Krista Deans, and I manage public relations at San Ramon Regional Medical Center. And for today's presentation, we have the pleasure of introducing Dr. Fadel Shammout. He is an OBGYN at San Ramon Regional, and today he's going to be answering some of the most asked pregnancy questions. Thank you so much for joining us today, Dr. Shammout.
Thank you, Krista, for the wonderful introduction, and thank you to the whole team at San Ramon for this wonderful opportunity to speak about the most common question in pregnancy.
Of course. We're happy to have you, and we'll let you share your screen and we'll get going on some of these questions.
Perfect. Okay. So I'm sharing my screen. Can you see it, Krista?
Yep, that's perfect.
Fantastic. So before we start talking about questions, I want to think about normal life for everyone and anyone. And what I see everyone doing usually is working or studying, maybe exercising, or enjoying the beach, taking care of a family member, elderly or young, sometimes sick member, having fun, having a glass of wine, enjoying some gathering, maybe smoking, whatever it is, having some intimate relationship. So a lot of things can happening in normal life, right? And all of a sudden, some people find that they're pregnant. Oh my God. And this is by data about half of the pregnancy in the nation. Close to 50% of the pregnancy are unplanned. And this is where the most common questions come, right? People who are not prepared, not even people who are prepared have a lot of questions, but this is where most of the question comes usually. And a lot of times people don't know what to do right away. What should I do from the get-go? Can I continue to exercise? People who are exercising, and that's major part of their life. How much should I eat? This is a common question, especially in first-time moms. And is sex allowed? So this is just few of the questions that we will address today. And of course, if we have more, I'm always happy to answer any more. So I'm gonna let you, Krista, ask the question, and I'm happy to answer it. And we'll keep going through the whole presentation.
Okay, sounds good. So the first question, should I wait until my pregnancy belly shows to call my OBGYN?
So this is an absolutely no. Please do not. Usually the earlier you call us, the better. Definitely we do not want to wait until you are advanced in pregnancy. Belly will show usually in the middle of the pregnancy, close to 20-24 weeks. And especially if people have some history, significant history, that need meticulous follow-up at the beginning of pregnancy, we might need to see them as soon as they have a positive pregnancy test. Others who might not have any medical issues or past history that can affect their pregnancy, we might tell them 6 to 8 weeks gestational age is the perfect time to start prenatal care. But let us make that call. Call your OBGYN, call us, and let us make that call to when to start. Do not delay it, please.
Okay, next question. When should I start taking prenatal vitamins?
Right. And this is honestly a very common question. You'll be surprised how many people ask this question even when they are pregnant. And the right answer is before pregnancy. So if you start 1 to 3 months prior to conception, it's the perfect time. And this is for multiple reasons. One of the elements in the prenatal vitamin is folic acid. And taking it a month before you start the pregnancy, before conception, decrease the risk of malformation, such as spina bifida. Now, there are data showing that taking prenatal vitamin up to 3 months before pregnancy can decrease your risk of morning sickness. which if you ask any pregnant patient who had morning sickness, they will tell you how unpleasant that is. And the more you can do to decrease it, the better the outcome. So definitely before the pregnancy, but if you have not started and you found that you're pregnant, start right away. Prenatal vitamins can come in multiple options and forms, from the chewable to the pills, tablets, liquid, a lot of options. So if you are not happy with the big pill that your provider prescribed, ask for different options. All right, moving on.
Very important question. Should I avoid prenatal care to minimize my exposure to COVID-19?
Right. And this is a question related to our current pandemic, unfortunately. So absolutely no. Do not avoid prenatal care. Now, always think about prenatal care as a preventative measure. And part of it is preventing and minimizing your risk of getting COVID. And if this is a major issue, nowadays we have the option of telemedicine, clearly. And our highest level organization, the American College of OBGYN, put some guidance for us to when we can do telemedicine, at what visits, and what visit need physical exam, and what visit need the patient to come in. Now keep in mind that hospitals and doctor offices are doing all the measures to minimize and prevent that virus from going to you. So when you come to us, we want to make sure that you don't catch it more than what you want to make sure you don't catch it. I promise you, if you go to any grocery store, any Walmart, Costco, you have a higher chance to catch COVID than coming to office visit. So definitely not. COVID risk is minimum when you come to your prenatal visit, and we sanitize everything. You will see us wearing masks and shields. And of course, when you come in, we'll talk about all the strategies to minimize COVID.
What type of food should I eat?
This is, again, a very common question, right? Everyone wants to do the best to their babies and do the best to themselves as well when they're pregnant. Now, simply, balanced, healthy diet is what we want everyone to eat if they are pregnant or not pregnant, and keeping that balance between carb and protein and fat, good fat, of course. That's the key word. Do not overeat anything, and do not undereat anything. Clearly, just it has to be a balanced diet. But when I talk about this question specifically, I tweak it a little bit and tell people what to avoid, because healthy diet, balanced diet, everyone know mostly what it is. But the important thing that we want to avoid, clearly, one is the uncooked food. Because we don't know what kind of bacteria, what kind of germs, what kind of viruses are there, and what's the risk of transferring to the baby. So all of this uncooked food, preferably, it needs to be avoided. And if it has to be eaten, it has to be in a very limited amount. Common question about uncooked food, usually lunch meat, which we prefer, if it's not well processed, to be avoided during pregnancy. In this question, the seafood question come usually, and what kind of fish can we eat? And we have a clear list of what fish should be eaten. A lot of people stop eating all seafood in pregnancy. That is not recommended. There are certain proteins and certain elements that we can get only from seafood. So definitely you'll need to eat the good ones. You'll need to avoid the bad ones that have a high amount of mercury generally. And I put some example here. Usually they are the one that live in the deep ocean. So they get a lot of mercury, and that's why we want everyone to avoid them. But 1 to 2 ounces of salmon, normal tuna usually is fine. And another one to avoid, and important to avoid, is anything that's unpasteurized. So people who have a cow, live in a farm, we always tell them, please avoid drinking milk from the cow directly. That is very risky because of a specific germ called listeria. That can increase the risk of miscarriage, and that can increase some other problems in pregnancy. So anything unpasteurized is not recommended in pregnancy. What you buy from grocery store is pasteurized. So if you buy cheese, if you buy milk from any grocery store, it should be totally fine. Another one that comes frequently is caffeine intake. Most people nowadays, including myself, we rely on caffeine a lot to just do our daily duties. And any woman who gets pregnant and usually have a cup or 2 cups of coffee, they're so worried about that cup or 2 of coffee. Now, again, evidence-based medicine, this is what the best data that we have up to date is avoiding a high consumption of caffeine. No more than 300 milligram per day, no more than 12 ounces of coffee every day. So that's what is recommended, especially in the first trimester. Higher than that amount might lead to increased risk of miscarriage. Now, higher than that amount as well through the whole pregnancy might lead to some long-term issues in the baby and the behavioral issues. So limiting that to 1 or 2 cups is okay, but if you need that 1 cup of coffee, please drink it. Do not try to kill yourself just because you're pregnant. Okay, and moving on.
I love this one. It feels like we hear often, I'm eating for 2. So do I need to eat twice as much as I used to?
Exactly. This is another common question. So I'm eating for 2. Do I need to eat twice as much? And the answer is absolutely not. If you are starting with a normal body mass index, BMI, at the beginning of the pregnancy, the recommended number of calories that you need to add on a daily basis is approximately 200. That's through the whole pregnancy. If you are starting on the lower end, you might need to add an extra 100. If you're starting on the higher end, it needs to be less than 200. So your daily amount of food that's needed if you're just doing normal function is about 2,200 calories. So you definitely do not need to add another 2,200. And that will lead to a lot of excessive weight gain in patients, which might be very hard to get rid of later on, and might increase some complication risk in the pregnancy that affect baby and route of delivery and even future of the baby after delivery. So definitely not as much as twice. Enjoy your food, enjoy the extra 200 calories, but do not overdo it for sure. Very good question.
A glass of wine weekly won't hurt my pregnancy?
Oh my God. No, it could hurt your baby for sure. And this is where, again, our major highest organization in the nation, American College of OBGYN, come with a strong statement. Not any consumption of alcohol is okay in pregnancy. And this is because any alcohol exposure can increase the risk of complication. And the way the brain is forming and developing usually is the most vulnerable thing to alcohol use. So even a small amount can lead to problems in the brain formation and maturity. And for that reason, not any amount is allowed. Not a glass of wine, not a can of beer, regardless of the concentration, regardless of the type. I have some patient who asked me saying, yeah, Chardonnay is okay, but Merlot is not. I was like, no, all of them has plenty of alcohol. So please, let's avoid it. So definitely do not use any alcohol in pregnancy.
Can I exercise while I'm pregnant?
Yes, please do. 20 to 30 minutes daily is wonderful. If you cannot do it daily, let's do it about 3 times a week. Okay, so moderate exercise is definitely recommended. Depending on how much patient was exercising before, we recommend to stay close to that as long as their body's tolerating it. As patient advance in pregnancy, usually it's harder to keep up with that because baby is bigger, harder to breathe, harder to walk, but um, patient body will tell them when to stop. And as long as they don't overdo it, it's not harming, it's actually more beneficial. And exercising can decrease the risk of gestational diabetes and decrease the risk of making clots in the mom legs and lungs. So a lot of complication can be decreased in pregnancy if the mom continue to exercise. Now, a common question come with this is what type of exercise should I avoid then if I can exercise? Is there any risky exercise? So number one, I'd say that usually the one exercise that I want you to avoid is staying a couch potato. That's not a good exercise for anyone. Four type of exercise to avoid is one, team sports. If you play soccer, volleyball, any team sport that have a higher risk of injury to the abdomen that need to be avoided. Two, sport with high risk of fall. So if you are riding horses, playing some gymnastic, this need to be avoided definitely. You do not want to fall. That fall have a high risk on the placenta, and it might cause it to separate. Three, any kind of sport with a high temperature. So no hot yoga, no saunas, no hot tubs, anything that have a high temperature can cause negative effect on the pregnancy and the baby. And last but not least, no scuba diving. So those are the most commonly recommended to avoid in pregnancy usually.
Could sexual activity hurt my baby?
And this is another very common question. No, it's not usually hurting your baby. One of the patient husband asked me, can I poke a hole in the baby head? I was like, no, you cannot. I promise it's not. So this is where the understanding of anatomy comes, right? So the baby is sitting in the upper part of the female genital part. So it's going in the uterus. That's where the baby is sitting. There is a big, thick layer that's protecting the baby underneath the uterus called the cervix. Okay, so that's a closed and full of fiber and a good protection. Now, in addition to the cervix, clearly there is fluid around the baby and there is muscle of the uterus around the baby. So baby is in a very protected area. Sexual activity happen in the vaginal area or the external genitalia. So nothing, regardless what you do, can reach the baby. Okay. There are some rare exceptions. Clearly, people who have dilated cervix and bulging membrane, and that's usually we tell them, and we tell them that's the diagnosis before they know it, and we tell them to avoid sexual activity. But generally speaking, go have fun, enjoy sexual activity. It should not be forbidden in pregnancy.
If I get bad morning sickness, is my baby okay?
It's not correlated, let's put it this way. So a lot of people link the morning sickness to a good pregnancy and not getting morning sickness to a bad pregnancy or suspected miscarriage. It's not the case. It's just the morning sickness in general, it's a reaction in your body because of the pregnancy hormone. So if your body is reacting badly, you get the morning sickness. If you are among the 15% that do not get the morning sickness, please enjoy it. Be happy about it. Don't worry and stress about your baby not being fine. As I said, 15%, 1/5, out of all pregnant patients do not get morning sickness. So it's not correlated.
What can I do to prevent stretch marks during pregnancy?
Another very common question, okay? And there are a a lot of expensive creams that can be bought over the counter. None of them have good evidence-based medicine to prevent stretch mark. Usually stretch mark are more genetics. So if your genes are gonna cause stretch mark, they're gonna cause stretch mark. Now, the two things that you can do, usually staying well hydrated. So if the skin has a lot of fluid, it's less likely to have stretch marks, and avoid excessive weight gain. And that's another benefit for exercising. Excessive weight gain and fast growth can stretch the skin and allow those stretch marks to look big and make them worse as well.
Okay, when can I feel my baby's movement?
Another common questions. So there is no one set for everyone. And the most common gestational age that most women feel their baby moving is usually between 16 weeks to 24 weeks. You see the range is about 8 weeks. So as you have more pregnancy, usually second, third pregnancy, you start to feel them earlier. And first pregnancy, it will take a little bit longer. Now, it depends on a lot of factors. One of them is how active the baby, one of them how sensitive mom is, and another one is the location of the placenta, the afterbirth. Usually if it's on the front part of the uterus, it makes it harder for the mom to feel this movement. Now, as they start moving, those moves will become more aggressive. And by reaching usually 32, 34 weeks, mom is in pain because how aggressive baby is. And they want them to slow down. But again, it's not in our hands. It's up to the baby.
Okay, my pregnancy is high risk, so I'll need a C-section.
Not necessarily, not necessarily. It all depends. So C-section is not an outcome only of high-risk pregnancies. Even normal low-risk pregnancy can end up with a C-section. It depends on what's the indication, why the pregnancy is high risk. Again, every pregnancy is different, so that assumption is not always true. Now, C-section is done only when it's safer for mom or baby or both to deliver via C-section. Otherwise, always our goal to end up with a normal delivery that's easier for mom to recover and usually have benefit to the baby as well.
Can I sleep on my back?
Another common question. Usually it's okay at the beginning of the pregnancy. Now, during the second half, it's mostly bothering you. The baby and the uterus are putting pressure on one of your vessel and make it harder for your blood to go back to your heart and cause some shortness of breath. So if you want to start training yourself at the beginning of the pregnancy to sleep on your side, then that's the right time. As you're getting close to the second half of the pregnancy, it is preferred to sleep on your side.
Can certain food or drinks induce labor?
I truly wish that's the case. And honestly, baby is in charge. Whenever they want to come, they will come. No spicy food, no certain activities will induce labor itself. And certain activities and certain food might cause some contractions, some practice contractions sometimes. If people get dehydrated, they start to have some contraction, but that does not equal labor. When baby is ready, when the body is ready, that's when labor happens. But I wish it was true. We would have given all pregnant women some food or some drink at the end of the pregnancy and avoid induction of labor, which is done by medication usually.
Can I hurt my unborn baby by bending over during the third trimester?
It's not the case. No, baby is well protected. They are surrounded by multiple layers, as we said, from the, in addition to your, the mom parts, the skin, the organs, the internal organs, the baby is surrounded by the uterine muscle, a lot of fluids. So when the baby gets annoyed when you are in certain positions, most probably they will flip and avoid where they are. So you're not gonna break their bones, I promise. You're not gonna squeeze them too bad. Usually bending is hard for mom more than babies. And the key word is to use your knees instead of your waist. And so that's where the maximum pressure should be to minimize that discomfort.
Do I need to get an epidural?
Do you need to get an epidural? Well, totally up to the patient. Usually it is an option. Clearly it's helpful option to minimize patient pain. But if any patient is interested in natural birth and going without pain medication, without epidural, that's totally fine. Very rarely there are certain medical issues that we recommend epidural for. If there is a heart issue and we do not want to overload the mom heart with a lot of stress, then definitely that's the only time that we recommend epidural or additional pain management.
Are you sure my baby will deliver on my due date?
Again, I truly wish. Not necessarily. So the due date is when the pregnancy is hitting 40 weeks exactly. It is just for all the measures in pregnancy, from when it's okay to deliver, from when we need to do ultrasound, from when we need to do certain blood work, certain screening stuff. So deciding when is the due date is mainly to know how far you are right now and to give you the right treatment and the right blood work or right testing. So most babies do not deliver on their due dates, let's put it this way. And most babies deliver anywhere between 3 weeks before their due date all the way up to 2 weeks after their due date.
Would my pain be worse if I get induced?
Again, a little bit of misconception here, so not necessarily. A lot of people link worse pain to induction. Now, pain is going to happen. Contractions need to be strong enough to get the baby out. But when we induce labor, we're causing the contraction to come a little bit faster than the natural process a lot of times because it's forced. And that's why people feel it's higher pain level because they're coming a little bit faster. So yes, pain is going to happen regardless if the labor is induced or spontaneous. And just because when it's induced, you have a faster coming contraction, that's why people feel more pain.
What vaccines should I get during my pregnancy?
That's an excellent question, especially during this pandemic. So the two well-known are the flu vaccine and the Tdap. And the flu vaccine, clearly, if your pregnancy, anytime in the pregnancy, you're going through the flu season, that's recommended. Catching the flu in pregnancy can make the mom very sick. The Tdap is mainly to give a booster to the mom, regardless of her immunity history, and that helped the baby to born with some immunity against the pertussis. So that's the reason for the Tdap, and it's given usually in the third trimester. COVID, to our knowledge, and that's coming from, again, our high organization, the American College of OBGYN, should not be withheld from pregnant patients if they are among the tier that getting vaccinated. We don't have enough data. We have small amount of patients who were enrolled in the studies, Moderna and Pfizer, and they did not show any bad outcome, but they were not intentionally pregnant at that time. Number two, from the theory standpoint, the way this vaccine works, it should not cause any damage. So definitely, if you are a healthcare worker, let's say, we recommend COVID vaccine to you at this stage. And as it's becoming more available to everyone in the public, then yes, it's highly recommended, especially if you have some high-risk issue or other comorbidities. Wow, we're done.
Very nice. That was wonderful information. I mean, you covered a lot of different topics, but if we have anybody who does have follow-up questions or maybe any questions that we didn't cover, definitely go to our website and click on our Contact Us page, and we'll make sure that we get you in touch with Dr. Shammout.
Perfect. Again, Krista, thank you so much for this, and I'm more than happy to answer any more question you might have.
Thank you so much. We appreciate your time, and thank you to everyone who joined us. And this will be posted on our YouTube page also if you joined late. So thanks, everybody.
Thank you.
Take care.